So we've had three presentations on similar subjects: reasons and solutions against brain drain and professional isolation of health professionals and its effect on healthcare provision in remote primary care, strategic opportunities presented by the new technology, and stakeholder involvement. And you can ask questions specifically to one of our professors, or you can ask questions to all three of them in general. Would anybody like to begin? Okay, Professor Weinerus, you mentioned in your speech that there are many different solutions against brain drain, and that teleconsulting is one of many. But how important out of all of those would you say teleconsulting is?
You know, I think these new technologies which appear and now, and it will be prolonged in future, those technologies can increase power of our physicians. And this teleconsultation, as mentioned, and Professor Peter Ross, it could be managed not only physician, but as well physician and another specialist, or even, I think, another level of healthcare specialist, nurses and so on, and then patients. So we have a lot of kinds of those teleconsultations. We need to take care about this, identify the needs in every position, and to find optimal solutions in every of these teleconsultations. So I think this is a common future for all Europe and even for all world. It will be no another way, but we have constantly aging population. Costs for teaching of medical staff increase all time, and will increase because newer technologies and very complicated technologies appear in medical field. So I think it's only solution to have these new forms of communication to solve all those problems.
Mr. Berglund, you worked in your work package on stakeholders. You divided the stakeholders in different levels. You divided in national and regional and local level. So is there a difference between these levels? I suppose that a regional level is easier to say, yes, we will do it, because the influence or the consequence of their agreement would be not so wide. But today in the morning we have stakeholders on national level, and for them I think it's much more difficult to say, yes, we will do so, because yes, the consequences are wider. What was your impression about the different levels?
I think you must consider the contextual factors as well. It's different from different countries. For example, Estonia, with a population of 1.5 million, such a decision is more easy to take on a national level than in Sweden, when you have 20 different county councils with independent decision-making in healthcare policies. But of course, there must be a national strategic pointing the direction to help regional and local areas to be brave enough to take decisions in this direction?
I have a question to Peter Ross. Maybe it's a bit local question, but anyway. Just a week ago I heard the leader of the big hospital, one of the two of the biggest hospitals in Estonia, saying that there are 90% of data, patients' data, used in the same system of the hospital, and there is no need to share them. The percentage which should give the benefit is so little. Do you have any arguments against it or to support it? Thank you.
Thanks. It's a very relevant question. So, well, if we look generally the spectrum of patients in hospital, then half of them will be quite well without any treatment, as we know, anyway. So then there are left only 40% which is not covered using national information system, and then yes, 10 is then what today, or those patients whom data today are viewed from the central system. I would like to recall you this slide with this pyramid where we saw what costs the most. So there is less than 1% of patients which cost the most, let's say 90% of the healthcare. And actually, if I'm working as radiologist, I agree I use maybe in 10% of cases central system. But then when I view patient data outside the hospital, they are complicated cases. And if I won't use it, I'm pretty sure that the price of this treatment, not speaking about the future of the patient, will be much worse. So it's not the key for public health in general, this national health information system, but it's obviously the key to improve patient safety, improve quality, and decrease or at least keep the costs on the same level. Does it make sense?
Hello, my name is Caroline van Leeuw and I'm a GP from Holland. And I'd like to raise the issue of the safety on data. Of course, here in Estonia, everything is perfectly organized by our government. But how about in Sweden, for instance? And I put this question because in Holland, there's a large resistance to connecting systems to each other on the argument of safety. And there's a lot of political resistance there. So I'm eager to know how you resolve this problem.
That's a difficult one. I would say we haven't resolved that problem in Sweden yet. As you say, there are a big resistance and afraidness of sharing data. But if you look at Facebook and other social media, the population doesn't seem so afraid about sharing data. So I think it's a generation aspect mostly in this. It also has been one of the reasons for delayed individual statistics on community and county council level in Sweden. So actually we have sparse knowledge about the population's need of health due to the fact that we don't use individual data, just group data in the planning. So we're waiting for such data, and there are a lot of efforts, political efforts, to be able to create such data. And we also have coming the national patient overview where the main medical record data will be stored and available for all health caregivers. But also there is another problem, and that is who owns this medical data. And unwillingness to share them with other medical professionals. So that's one of these financial obstacles that we need to find solutions for in the future.
Thank you. I come from Sweden, I'll say it again. I just wonder about another aspect of financing, and that is budget allocation. If we just think that we have already implemented e-health telemedicine solutions in large scales, how are we then allocating our budget? Is there more staff for technical support in each clinic who are giving technical support for patients? And are there less of other kinds of staff and such issues? I would just like to hear if you have any thoughts about it.
Who would you like to take this question? All of us. Okay, I'm the youngest one, so maybe you can start.
One of the hopes with e-health and telemedicine is that the patients should be more responsible for their own health. By this we mean there will be a saving by applying new health. I'm not sure about this, but we also have the demographical change which will challenge the healthcare systems in the future. I don't have a good answer on your question, what will happen to different staffs, categories, but I think there is a need for healthcare professionals educated in e-health and combining medical knowledge with digital knowledge.
What we know from the research is that usually, if you're talking about the implementation of large-scale e-health platforms, then these parties or stakeholders who make investments are not the main beneficiaries. And this makes actually this decision really, really tough. And even though I personally, I really, I see that in healthcare there should be a lot of entrepreneurship, and so we should know how much which thing costs. Then talking about large-scale data sharing projects, then they should be, in my mind, funded by the government or by local government or by institution which really don't have direct loss or benefit of this implementation. We know that the benefit comes not in a couple of years. Benefit comes not sooner than in 5 to 7 years. This is also proven by research. So tough question, yes.
Any more questions?
Sergei Bataev, Grodno State Medical University. Maybe that's not right place to ask these questions, but I'm just interested for your professional opinion. We were talking about telemedicine a lot today, but still all the professional medical association membership and all the prominent medical sites information access are not free at all. So what would you think, maybe under some EU regulations, making this access free for certain countries and regions, would it help to avoid some brain drain and professionalization, or it make things worse? How do you think?
Well, definitely information should be free if you're talking about professional information. And this trend in the world actually is quite obvious that there are publishers what are coming up with open access. We know this. So this is a trend. From this project, I can give a very good example from Estonian Society of Family Doctors, where we saw how they are using their common platform for educating their own members. So making common effort to share the same education material throughout the country is one of their purposes. So I think, as you asked, is this something what is not desired? No, vice versa. In today's world, if we don't share information with each other, then tomorrow we are lost already.
Anybody else? Okay, one question for all the panel, but the question comes from Professor Ross's presentation. Professor Ross, you said that the media isn't the right way to publicise the benefits of tele-mentoring and tele-consulting at the moment because, as you said, they want blood. They're not interested in how we can save blood. So, and many stakeholders might be naturally against this idea to start with. So if the media is not the way to spread the positive image of this, what could be a positive way? Can you explain a little bit more about that?
Thank you. Thank you for this question. My point was actually that we should raise awareness of the society. My assumption was that maybe the press is not right place to start from. However, here we have benign journalists, I know. What we have to exploit clearly are professional journals. How to cope with yellow press? This is, I think, totally different subject. I don't see that in daily newspapers we can systematically promote health, at least in this part of Europe today.
Okay. Before we take a break, are there any more questions? Okay. In that case, I'd like to thank our three professors for their work during the project and also for their presentations today and their answers to our questions. It's a valuable part of the project. Thank you very much.